Hello, my name is Simon Garrett. I'd like to thank you for inviting us to share some of the work that we've been doing looking at mobile tracing technologies for the COVID-19 pandemic. So it's clear now that COVID-19 is a global phenomena that has been having a huge impact on societies across the world. At latest count, there were 36 million people with known infections and over 1 million people that had died. And so there's a real premium on coming up with technologies and methods that are able to prevent the spread of the disease. So one of those methods or technologies is smartphone or other kinds of automated contact tracing. So the idea behind automated contact tracing is that if we have one person who has become infected, and we know that, then what we'd like to do is stop the spread of the disease through their contacts. And so if we can quickly identify who might be at risk, we can ask them to self-isolate and therefore potentially prevent the spread. So for instance, if this person is infected, if we're able to quickly identify this person as a potential infection, then we ask them to isolate, and that stops the spread to all of these other people. Now, in order to be able to do that, though, we need to be able to identify when people were in close contact with each other, and not just at the time that we know the person has become infected, but in fact before that point when they would have been infectious and could have spread the disease. So, the use of smartphone technologies or other contact tracing technologies can really help us to do that, provided people are willing to actually accept them. And so that's a key element, and one of the things that we were very interested in investigating. So the project has been an international project. So far, 9 countries have participated with their own surveys, and they include Australia, the UK, the US, Germany, Japan, Taiwan, Spain, Italy, and Switzerland. Now, in each case, the situation has been somewhat different. It's different as a consequence of the where the country is in terms of the spread of the disease. It's also different in terms of the kinds of technologies that are being contemplated in that country. And so the surveys have been somewhat different in each case. But what I'm going to do is give an overview of the kind of prototypical survey, if you like, and then just be aware that different countries have implemented different surveys at different times. The first thing to say is that where possible, we've attempted to stratify our samples, and we've stratified by age, gender, and region of residence. You can see some of the results there from the Australian samples. Perhaps one thing to note is that in general, our samples have tended to be on the higher education levels, so more graduates from universities than would be typical of the general population. But otherwise, we've attempted to stratify in most cases. Now, this is the overall pattern that our surveys have taken. So there's been a demographic questions to begin with, and then we've asked a series of questions about the perceived harm or risk or concern over COVID itself. We've then asked about what people believe the impact of COVID is, and then some questions about getting people to estimate how many fatalities there have been in their own country as well as other countries, and also to estimate to the degree to which people in their country are complying with any government regulations that are in place. We then gave people, each person, one scenario. So they each received a description of a particular technology that could be introduced, and all of the subsequent questions are related to that technology. We then asked whether that technology was acceptable, In some cases, we asked them, would you download this technology if that was appropriate? Or when the technology already existed, sometimes we asked, have you downloaded the technology? And so obviously those are somewhat different questions, and as you'll see, there's quite different answers. Then what we did is we asked a series of questions about the effectiveness of the technology, what people believed about that, and then what they believed about the potential harms of using that technology. And so that would be related to things like invasions of privacy and so forth. We then asked a second acceptability judgment. We did this to allow us to get a sense of to what degree being made aware or foregrounding some of these issues about effectiveness and harm, to what degree does that actually influence people's judgments of acceptability? If people said no, that they didn't think it was acceptable, we also asked some follow-up questions. So we asked, for instance, would they find it acceptable if there was a sunset clause, which said that this would only be used for a set amount of time and then would be discontinued. And then if they still said no, we also asked whether it would matter if there was an opt-out, so the ability for people not to be involved. In some surveys, we also asked immunity passports, and also in some cases about people's general worldview, so to what extent were they libertarian or not. So the perceived harm and risk questions were the following. So how severe do you think the novel coronavirus will be for the general population? How harmful would it be for your own health? And how concerned are you that you might become infected? And how concerned are you that somebody you know might become infected? We also asked, have you ever tested positive to COVID-19? Has somebody you know tested positive to COVID-19? There weren't very many people in either of those categories in our survey. And then how many days, if any, have you been in quarantine or self-isolation? So as you can imagine, if people who have been in these isolation kinds of situations might have a different opinion than those who haven't. And so we thought that might matter. We also thought that whether a person had lost their job as a consequence of COVID-19 might impact their decision-making processes. So we included that. Then we gave them a set of scenarios, and the scenarios were designed to cover off on different kinds of variation in the possible technology. So one was the kind of technology that was being used to do location tracking. So was it done via telecommunication networks, which case it applies to all phones? Was it done via GPS tracking, in which case there would be a record of people's specific locations? Or was it done using Bluetooth tracking, in which case the contacts would be retained, but not the locations of people? We also asked them about, or had scenarios that talked about either centralized or decentralized storage. So did the technology involve some central repository of information about individuals, or was it completely decentralized, so just spreading from one person's phone to another person's phone directly? So this gives you an idea of one of the scenarios that we used. So we started with some general comments about the pandemic, and then we highlighted some key aspects of this particular scenario. So in this case, we're talking about a mandatory government mobile network tracking. And so we highlighted all people using a mobile phone would be included in the project with no possibility to opt out. The data would be accessible only to the Australian government, who may use the data to locate people who are violating lockdown orders and enforce them with fines and arrests when necessary. So we tried to pull out those specific items that were really the crux of the scenario, and to make sure they were highlighted in people's minds. And we also had people go through a comprehension check to make sure they were reading carefully. Once we've done that, and we've asked our acceptability question the first time, we then ask the effectiveness and potential harm judgment. And all of these were on Likert scales. And so the effectiveness questions that we asked were, how confident are you that the described scenario or technology would reduce your likelihood of contracting COVID-19? How confident are you that the described scenario would help you resume your normal activities more rapidly? And how confident are you that the described scenario would reduce the spread of COVID-19? So those are all focused on, did people think this particular technology would be effective? The harm ones were focused around what was the cost of participating in the use of this technology. And so that depends on a number of different aspects of the technology. And so we're looking at understanding how people thought about these different technologies. So we asked things like, how difficult is it for people to decline participation? To what extent do people have ongoing control of their data? How sensitive is the data? How serious is the risk of harm from the proposed scenario? How secure is the data? To what extent is the government or Apple, Google only collecting the data necessary to achieve the purposes of the policy? Do you trust the government to use the tracking data only to deal with COVID-19? And do you trust the government to be able to ensure the privacy of each individual? So those were the questions we asked. And that's all I'm going to talk about today. The questions or the results and conclusions will be addressed by subsequent speakers. But if you'd like to get some more detailed information, there are a number of links, one to all of the results from the different countries, and then links to two papers which are currently available, one about the surveys that took place in the United Kingdom, and another one about the surveys that took place in Australia. And I know there is one coming shortly for Taiwan. So thank you very much to my collaborators. So Paul, Josh, Cheng-Ta, and Stephan will be speaking to you shortly, but there have been another number of other people who have also been involved in the project. Thanks very much.
So thank you, Professor Simon Dennis, wonderful introduction. So the second talk will be given by Mrs. Yuwen Wang. Yuwen received her master's degree in psychology from National Taiwan University. Her research interests include social cognition, prejudice, and applying social psychology theories to tackle social issues. Now she works as a research assistant at National Cheng-Ta University under my supervision. The research project is about psychological resilience and mental health. In this talk, Yuwen is going to share the results of how the mobile tracking technologies are perceived in Taiwanese populations and how the acceptance of technologies is related to one's psychological resilience. So let's welcome Mrs. Yuwen Wang.
Good morning, members of Taiwanese Psychological Association. I'm Yuwen Wang. The topic that I'm going to present is psychological resilience and the perception of contact tracing technologies in Taiwan. This research was conducted by National Cheng-Ta University. Since a few months ago, the entire world had experienced a pandemic. The corona disease have taken away over 1 million people's lives. Around 38 billion and 500,000 of people were tested positive. This pandemic has affected you, me, and almost everyone in the world. During this pandemic, schools are closed, people lost their job, and some people even lost their beloved ones. This was a terrible experience to all of us. Unfortunately, in Taiwan, because of COVID-19, 530 individuals were tested positive and 7 people passed away. However, when we compare this number to other countries, Taiwan do a relatively good job so far for controlling the spread of COVID-19. One key difference is that Taiwan reacted quickly to the COVID-19. Our government have adopted many proactive measures. Compared to many countries went into lockdowns, most of Taiwanese life remained the same. Schools, companies, and restaurants are open. People can still have face-to-face commerce. Here are some examples of the proactive measures. Around the end of January, China travel restrictions were introduced. On March 18th, digital fencing tracking system was used to track people's location. Few days after, travel notice for all regions were raised to level 3, which means no matter where people are from, when they want to come to Taiwan, from March 21st, they need to be quarantined for 14 days. One of the policy really got our attention, which is using mobile phone to track people who come back from other countries. As this figure had shown, of the 530 confirmed cases, 438 cases are imported. Only 55 cases are indigenous. Thankfully, these imported cases were tracked by their mobile phone using telecommunication network. This is extremely helpful for us to control the spread. However, tracking people's location is a controversial strategy. More than 200,000 people were monitored by the government through their mobile phones. Around 900 people had violated the self-isolation rule. Privacy calculus theory indicates that people weigh the risks to privacy and the benefits of the policy, and then make their decisions. A policy is successful only if it is accepted by a certain proportion of people. For example, when using tracking app, the minimum proportion for the policy to be effective is 60%. Therefore, in controlling the spread of COVID-19, an important issue that needs to be investigated is people's acceptance to a certain policy or certain technology. Relatedly, in many countries, super spreaders were found. They have 2 characteristics. First, they were frequently engaged in social activities. Second, they almost didn't show any symptom. Do these 2 characteristics remind you a certain group of people? Okay, so young adults. Study has shown that young adults may be super spreader and play a crucial role in the second wave. So we think a study that understands young adults' acceptability is urgent and important for Taiwan, which should be prepared for the potential challenge it may face. In particular, we believe that people's resilience ability would play a role here. The definition of resilience is individuals' traits or states that demonstrate positive adaptations when they encounter adversity. Researchers pointed out that compared to people with low resilience, high resilience people tend to have less concern about the pandemic and lower level of anxiety and depression. However, in addition to the relationship of concern towards the pandemic, a further crucial step is to look at how people's resilience level is associated with their acceptance towards new policies. A clear understanding of this relationship may help to avoid the issues such as depression and other negative emotions, since the government can target people who need the most assistance. So in this context, we conducted this study. Our main question is, are smartphone tracking technologies for COVID-19 acceptable among young Taiwanese adults? We have recruited 1,087 Taiwanese adults who age 18 to 25. The data was collected from April 8th to April 29th, and their resilience ability was measured by Connor-Davidson Resilience Scale, also called City Risk. City Risk has 25 items, each rating on a 5-point scale, 0 to 4, which higher scores reflecting greater resilience. For example, when I'm in a difficult situation, I can usually find my way out of it. Here comes our hypothesis. Actually, in this study, we don't really have hypothesis. Just to remind you what kind of question we asked. Thanks for Simon's very clear introduction. I'm not going to repeat all of them. So here are hypotheses of perceived risk from COVID-19. And this is hypothesis of perceived benefits from tracking technologies. And these are hypotheses of perceived risks from tracking technologies. Okay, here comes our results. As you can see in this figure, our results have shown that participants view COVID-19 as somewhat harmful to others and were somewhat concerned for their own health. The virus was perceived as very harmful to one's health, and participant was very concerned for others. For perceived benefits from tracking technologies, all technology were perceived to be moderately beneficial. Telecommunication network tracking was perceived as the most beneficial for reducing the rates of contraction and spread of COVID-19. All technology were perceived to show similar benefits for resuming normal activities. Bluetooth was perceived as being the most risky technology, but it was also perceived as easiest to decline participation in. Data privacy, security, and ongoing control were perceived as equivalents across the technologies. The government app was perceived to have the most trustworthy intentions. Baseline acceptability was very high, 71 to 81%, and did not differ meaningfully across the scenarios. Acceptability increased with additional privacy options in the telecommunication and government app scenario, up around 90%. Resilience was measured by city risk, which ranged from 0, which means not resilient at all, to 100. Resilience score were moderately to high. Mean is 62, and standard deviation is 12. Results shown that weak correlations between resilience and perceived that tracking technologies will reduce the likelihood of contraction, aid in return to normal activities, and reduce the virus spread. Resilience also weakly correlated with trust that data privacy and data security would be preserved, and the perception of ongoing control over one's data. However, no significant correlations were observed between tracking acceptability and psychological resilience. The high acceptability indicate that young Taiwanese adults would support the policy. Additionally, acceptability increased with the inclusion of additional privacy preserved measures, which infer that Taiwanese people do care about their privacy. So policymakers can emphasize the protection of privacy to increase the acceptability of their policy. Another interesting finding is that concerns for the health of others is very high. This may imply a strong sense of communal responsibility. Since Taiwanese confirmed cases and severity of the virus are relatively slight, our finding can be considered as a baseline for COVID-19 tracking acceptance. On the other hand, psychological resilience did not play an important role in the acceptability. We speculate that this may be due to the homogeneity of our sample, which are mostly college students. However, This limitation does not undermine the value of this study. We established acceptance among a critical COVID-19 demographic, which is young adults. Nonetheless, we were thinking we should improve our generalizability. And we made it. We conducted the second study by recruited participants from all over the country and people from different age groups. 6,000 Taiwanese adults were recruited. We used stratified sampling to get data from different areas in Taiwan, people aged 20 to 80. We also collect psychological resilience by using CD risk. Here comes our results. Most of the primary results hold, similar to study 1. Similarly to study 1, COVID risk factors had an effect on acceptance. Tracking privacy, security, and control affected acceptance. No effect of age on acceptance. So the high acceptance we found in study 1 is not an artifact of young people. Most importantly, acceptability was improved with resilience. People with high resilience have a higher acceptance towards 3 technologies. Most of the primary results hold, as I mentioned, but the result of resilience was different. We found that resilience has an impact of the acceptability. This is important in countries that are experiencing a more serious threat from COVID-19, since resilience may play a more pronounced role when people facing a very difficult situation. Okay, so this is our conclusion. First, we examined the crucial group that may rapidly spread the virus, which is young adults. Second, we investigate national attitude, which must be understood to ensure the efficiency of the policy. We found high acceptance in both of the studies, and when privacy measures were enhanced, the acceptability increased. Most importantly, psychological resilience may play a role here. Thanks for listening.
Let's thank Mrs. Yu Wang again. So the next talk will be given by Professor Stephan Lewandowski. Professor Stephan Lewandowski, cognitive scientist at the University of Bristol. He was awarded a Discovery Outstanding Research Award from the ARC, Australia Research Council, in 2011. He was also appointed a Fellow of the Academy of Social Science and a Fellow of the American Psychological Sciences in 2017. During the COVID-19 pandemic, Professor Lewandowski coordinated a team of international researchers to assess the acceptance and uptake of COVID-19 mobile tracking technologies. His work has already informed policy decision makers in the United Kingdom and the United States. In this talk, Professor Lewandowski is going to share the results of what he found in the United Kingdom and the United States. So let's take a look at the Professor Lewandowski pre-recorded video.
Hi, I'm Stephan Lewandowski from the University of Bristol. What I want to talk about today is one aspect of ways in which we can control the COVID-19 pandemic, which at the moment can only be done through behavioral means. And we're all familiar with things such as social distancing, exercising hygiene, and wearing masks that are steps towards getting the pandemic under control. There are 2 things I want to talk about today, 2 other technologies that are behavioral to some extent, but that go beyond simply our own personal behavior. One of those relates to contact tracing apps, mobile phone technology that allows people to be informed when they're in contact with each other and then turn out to be infected. And the other one is a hypothetical, possible future development known as immunity passports, which identify people who have recovered from COVID and therefore cannot spread it. And the question I want to address is, to what extent does the British public accept these technologies? The project is embedded in a global context. 9 different countries, more than 13,000 participants have been collected to date. And I want to find out whether people in the UK accept tracking apps. Just to illustrate what a tracking app looks like, this is a screenshot of the German tracking app, which has been around for several months and which 18 million people have downloaded, and which by all accounts appears to function reasonably well in alerting people to encounters with infected others. Now, our survey was conducted twice in 2 waves in the United Kingdom at different points in the pandemic, but just under 3 weeks apart. Once in late March at the beginning of the pandemic, 3 weeks later at the height of the pandemic in the middle of April. And it was a fairly complicated experiment, quite a few questions involved on both waves. I can't go through all of these. I will focus on people's acceptance of various different scenarios that we describe to them of tracking technologies. Here's a summary of those scenarios. We had 3 scenarios altogether. A mild scenario in which participation was voluntary and people were assured that the government would only be using the data to contact infected others, but that the data would be stored on a secure server. We then had a severe scenario with draconian measures. People were, in the scenario, forced to use the app. There was no opt-out, and the data could be used not just to inform people about their risk, but also to enforce a mandatory lockdown. So a very severe scenario. And finally, we had the Bluetooth scenario, which is very realistic because that's roughly what was developed by Apple and Google, where the government has no access to the data, and it is only the phones that talk to each other effectively, exchanging information when somebody has turned out to be infected. So those were the 3 scenarios we asked people about. Here are the data from the first wave, asking people on various different occasions whether or not they would accept the app. And I want to draw your attention first to the initial question that straight off the bat, we just said, hey, would you accept this scenario? And you find that people are a little more accepting of the mild than the severe scenario, even though the difference is rather slight. And what is remarkable overall is the high level of acceptance, which, is above 60%, without any additional information being provided. Now, if we do provide additional options to the scenarios, for example, if we say, hey, how would you feel if the data were deleted from the server after some time, after 2 weeks or something like that, then there is an increase in acceptance for both scenarios by quite a bit. We're now in excess of 75%. And if you add even more options to the scenario, such as local storage of the data for the mild scenario and the ability to opt out for the severe scenario, then acceptance is higher still. So very high acceptance that persisted into the second wave, which is shown here about 3 weeks later, where we again find a very similar pattern, high acceptance, but a difference between mild and severe. And with the Bluetooth scenario added into this, we now have a further ability to compare people's attitudes across different scenarios. And what you find is, again, high acceptance and perhaps surprisingly not a clear advantage for the Bluetooth scenario, even though that is, by all accounts, the one that preserves people's privacy the most. The other aspect of the data that's of interest are the variables that are driving acceptance. Now, I mentioned at the outset, and you could see that in the overview for the survey, that we collected a number of demographic variables. We asked people some attitude questions. We kind of collected a lot of information that might conceivably determine how much people accept the various scenarios. And I'm showing you the results of a regression analysis here. The dashed vertical line refers to the 0 point. Anything that straddles that has no effect. And what you can see is that wave had no effect. It didn't matter whether we tested people in March or April. What did matter were some of the demographics. People who were older were less likely to accept the apps. Women were more likely to accept the apps than men. And importantly, what really mattered also were people's attitudes. First of all, looking at worldviews or personal political beliefs scored as conservatism here. The more conservative people are, the less likely they are to accept the app, although that effect is actually fairly modest. What is far greater is the effect of the perceived risk from COVID. People who feel they're at risk, greater risk, are more likely to accept the policies. And conversely, those who think that there is great harm arising from the policies, the tracking app, not COVID, but the tracking app, they're less likely to accept those apps, as you would probably expect. But finally, the most important variable of them all is trust in government. People who trust the government are those who will download the app. People who don't trust the government will not. And now, in the second wave, we also asked people about immunity passports, this hypothetical, as of yet, hypothetical idea that you can identify people with immunity who cannot spread COVID-19, and we then give them passports that allow them to live without social distancing and to go out and meet people and so on. Now, the ethical implications are immense, and they're hotly debated, and we are not taking a position on that at all. We were simply interested in what is the public attitude towards immunity passports should they ever become feasible and available. Here are the questions that we asked people about immunity passports. We don't have to go through them in great detail, but you get the idea, you get the gist. We asked people whether they supported them, whether they were concerned about them, how much they liked them, and so on. And here are the data from most of the questions we asked. I want to focus on two, namely relating to support and relating to concern, sort of the flip side of support, relating to concern about immunity passports. And what we find is that generally people are quite supportive of immunity passports. I mean, the bars here on the right for support above 4 and above, there are people who actually support the introduction of immunity passports. And the people down here, around 20% at 1 or 2, they're the people who very strongly reject having immunity passports. So overall, we have a pattern of considerable acceptance, but with a notable segment of the population saying, no, 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 we don't support that at all. And of course, the reverse mirror image you observe for concern. Most people are not terribly concerned about the introduction of immunity passports, although some people are, presumably those who didn't support their introduction. So immunity passports are, again, perhaps surprisingly well accepted, but there is also opposition to the technology. So what can we conclude? Well, I think we can conclude, my take-home message is that acceptance is high of these policy measures. Acceptance goes up further if privacy is assured further through sunset clauses and other measures, which is suggesting that people are fairly well calibrated to this. And there are some very clear drivers of these attitudes relating to trust in government in particular, and that is obviously a crucial element of any policy. And with that, I thank you for your attention.
All right, let's thank Professor Lewandowsky again. So you can see, compared the second talk and the third talk, Taiwanese has a very, very high acceptance rate for the new mobile tracking technologies. So the fourth talk will be given by Mr. Joshua White. Joshua White is a research assistant for the Complex Human Data Hub at the Melbourne School of Psychological Sciences. He is interested in the role of computational modeling and big data and understands social and moral judgments, and has been working with Professor Simon Dennis to understand the social license for the use of Wi-Fi location data in university research and services, and for the tracking technologies more broadly during the COVID-19 pandemic. Josh graduated from the University of Melbourne, being awarded as both the Dean's Award and APS Prize. During COVID pandemic, Josh has helped design and analyze surveys on the public attitudes towards mobile tracking technologies, and among other countries, and will discuss the culture and contextual differences and their implications with the mobile tracking technologies in Japan, Italy, and around the world. So let's welcome Joshua White.
Hello, everyone. It's a pleasure to be speaking with you. Can everyone see my slides? I think they can. Okay, good. Yes, welcome from Melbourne, Australia. It's very exciting to be able to speak to you all. I'm going to be adding on the wonderful presentations you've just seen, but I'm going to be speaking about particularly two other countries that we've collected data from, Japan and Italy. And both these countries have decentralized exposure notification systems, which I'm going to speak about soon. So, first thing to note about these two countries is that they've had a very different COVID-19 context so far. So on the left, you can see Japan's cases and deaths on the graph compared next to it with Italy's. And as you can see, Italy has had an order of magnitude more cases and deaths due to coronavirus than Japan. So the interesting thing is that these two countries will be interesting to compare because they have such a different context in relation to their experience of the disease. Further, they've also had very different responses. So Japan is well known for one of the countries that's had very few lockdowns, no curfews, not much mass testing. On the other hand, Italy is known and was one of the early examples of having very strong lockdowns and curfews and mass testings. So not only has there been a different experience with the disease and how hard it's been, but there's also been a very different health response in general. But one thing between the two countries is the same, and it is their contact tracing solution. So both of them have come up with an exposure notification system, which we've already heard the other speakers talk about this, but it is it's a voluntary Bluetooth-based smartphone app which will anonymously notify users if they have been exposed to somebody who has COVID-19 or may have COVID-19. And all that data is kept on the phone and is decentralized. No government or authority keeps all that data anywhere. So the two apps that have been introduced is Japan introduced an app called Cocoa, and Italy introduced an app called Immuni. And they were both released in approximately middle of the year, this year. So of course, as other speakers have said, it's really important for us to know how these apps are perceived. This is because the effectiveness of contact tracing, and contact tracing apps in particular, is directly dependent on how many people, what proportion of the population uses them. And so thus, it really is necessary for policymakers and decision makers to understand public perception to ensure the greatest uptake and hopefully the greatest health response to the pandemic. So with that in mind, I'm going to be looking at the data from Japan and from Italy, and to look at how people perceive these apps. And particularly, I'm going to be focusing on what are the differences between these countries which have such different experiences of coronavirus but have a similar solution. So what are the differences between their perceptions? And then what factors are predictive of intention to upload these apps? So just to quickly go through again the survey. Now, you've already heard from the last few speakers about this, so I'm not going to go on for too long here. But both Japan and Italy both had pretty much the exact same survey with one small difference. You can see that in Japan, we asked them about two different scenarios, the Bluetooth scenario and the government app scenario, whereas in Italy, we only asked them about the government app scenario. Now, today, I'm only going to focus on the government app scenario because basically we've got the same scenario, so we can get a better comparison between the two countries, and also because the government app scenario is quite similar to the app that was brought in. There are some differences, but overall there are a lot of similarities. So it should give us an insight. So basically, participants' responses about these hypothetical government apps should give us a good insight about their perceptions of the actual apps that they've implemented. Cocoa for Japan and Immuni for Italy. So I'm going to focus on the acceptance and the acceptability of these apps from both these countries, and I'm also going to look at look at how the acceptance is related to and how the countries compare on the COVID risk and impact questions, on questions of the effectiveness of the technology and of the potential harm of the technology. So that's the focus of my presentation today. And that's just to remind you how it fits in with the broader project. So I probably don't need to go over this, we've already discussed this. So before we get into it though, I just want to quickly mention this concept of the privacy calculator, which I've taken a slide from Paul, who I realized Paul's actually speaking after me. So sorry, Paul, I didn't realize that. But the privacy calculus is this idea that when we decide whether to uptake a technology that could have privacy implications, we basically do a weighing up of the benefits of that technology and the negatives of that technology. So in the coronavirus situation, there's a few factors that are relevant. The first factor is, how is this virus perceived first? Are people scared of it? Is it dangerous? Are they are they worried about their loved ones, worried about themselves, things like that? So that's one thing we'll speak about. They weigh that up, but they also weigh up that in response with how the technologies are perceived. So that's meaning the negative sides of the technology. How might it be bad for privacy or other outcomes? And also the positives of the technology. How can that technology affect that virus or reduce the virus that we've already talked about there? So I just want to give that that slight introduction because we're about to really speak about this privacy calculus very shortly. Okay, so here's the results quickly. Now, I just want to quickly show the demographic statistics. So we had samples from Japan and Italy. Now, the first thing to note is our Italy sample wasn't very representative on age. We have a young skew of a sample, whereas our Japanese sample was very representative. So that's the first thing to just be aware of, is that the Italy sample is skewed towards younger people. And secondly, the Italy, and this is related to what I said at the start of my talk, is that in Italy, 44% of people knew somebody who had coronavirus, whereas in Japan, only 1.3% of people did. So that really does show the difference between these two apps, or between these two countries at the time of our surveys. So here is the acceptability of each of those apps. So what you have on the left-hand side of each of the clusters is the baseline acceptance. As Stephan Lewandowsky just said, it's when we ask them, just would you accept this technology without any further conditions pushed on that. We also asked people if they said no to the baseline acceptance, would you accept it if it was going to be more decentralized, and would you accept it if there was conditional? Would you accept it if there was a 6-month time limit on how long data and this whole process is continuing for? So what we see here is pretty clearly just very high acceptance in Italy, at about 73% before anything, before any of the conditional questions are asked, and going to about 85% or so when included with a time limit. Whereas in Japan, we're looking more at around the 45% to maybe about 60% if you're including conditional, the conditional acceptance of the 6-month time limit. Now, just to give you an idea of where this sits with the rest of our data, here's a quick snapshot of all of the acceptance of all the different countries that we've had in our survey. So as we can see here, Japan has the second least acceptance, very comparable with the USA, and Italy, on the other hand, has one of the highest acceptance. So there really is a big difference between these two countries in their perceptions of these apps and perceptions of the acceptability of them. So the question now is, well, why is that the case? And so now we're just comparing how they perceive the coronavirus situation. So
Josh, you've gone on mute.
Hello, I think I was muted for a second. Okay. Participants gave participants in Italy and Japan had very similar reactions to harm, but people in Japan were more concerned for themselves or for others of contracting the virus. So that seems to show people are more concerned in Japan than Italy, which might seem counterintuitive given the case numbers we saw at the start of this presentation. When looking at the benefits of tracking, we see that Italy and Japan also, participants from Italy and Japan also viewed the benefits of the tracking to be similar. There was no difference, and they saw them all as a bit likely to reduce contraction, a bit likely to reduce spread, and a bit likely to resume activities. The next one we see is the risks from tracking, and here's where we see a lot of differences between Italy and Japan. Now, there's a lot of information on these slides, so I'm just going to put you to the important parts. As you can see, Italy, the Italian participants judged the technologies as much more risky, as moderately to a lot, whereas the Japanese only rated it as a bit risky. We also see big differences in trust, where Japanese participants trusted the governments to have good intentions and to secure their privacy much more than the Italians. So overall, there's a lot in that graph. Overall, it shows that there are much bigger, so that generally people in Italy viewed the technologies as being much more risky and having much more negatives to them. So what does this all mean? So basically, this is just summarising what I said before. So basically, Italian participants saw saw more risk in the COVID-19 pandemic, and there was no difference between their perception of the technology benefits. But in general, the Italian participants saw greater risks in the tracking technology. When we compare these to each other, we see that the COVID risk was less for Italian perceptions, It was similar for the tracking technology benefits, but more risks was the perception for Italians. But then the acceptability of tracking technology is higher in Italy as well. So when we talk about the privacy calculus before, this doesn't seem to make a lot of sense. It doesn't seem like they're doing a good weighing up of these two different or these few different sort of parts of the decision making. So this could be a manifestation of the privacy paradox, which is where people in questions and in their values show high concern for privacy, but not always in behavior. And in this case, we have intended behavior or hypothetical behavior, but it still might be a manifestation of the privacy paradox. So lastly, the thing I'm going to look at is then we've looked at a group level of why there might be differences in acceptability between these two countries. Now we're going to look at individual acceptance judgments. So for individuals, what are the most predictive elements that cause them to accept the technology? Now here is a regression analysis. There's lots on the screen. What I want you to focus on is the bottom half. This is the interaction effects between the country and the variables we mentioned. So for these variables, we're looking to see whether these variables have different predictive effects in the two countries. And what we can see is there are a few where that's the case. So that is the case for personal concern. So that is where people are concerned of coronavirus for themselves and concerned of contracting the virus. That has a stronger effect in an Italian sample than the Japanese sample in predicting acceptance. Then we see a similar effect for ability, which is the usability of the app, how likely the person thinks they are to be able to use it correctly. So there we see where the usability rating has a stronger effect in a Japanese sample than the Italian sample. And lastly, for declining participation. So we see that the declining difficulty rating has a stronger predictive effect in the Italian sample than the Japanese sample. So overall, to conclude this whole talk, we have the idea that acceptance of tracking technology is really high in Italy, but quite low in Japan. The Italian data suggests something of a privacy paradox in which they seem to view the technology as quite risky and not necessarily giving that many benefits, but they still have high acceptance, which seems to be paradoxical somewhat. And lastly, personal concern about contracting COVID-19, the app usability and app declinability all predict the acceptability of the app differently in Japan and Italy. So maybe something about those factors is at play with the different acceptability ratings here. And of course, very different countries, there might be other things that are different between them. But that is all from me today. So thanks for listening. Here's all my collaborators and all the best.
Thank you for Josh's wonderful talk. So the last talk will be given by Dr. Garrett. Dr. Garrett is postdoctoral research fellow in the Complex Human Data Hub, studying causal models in complex human systems. He recently completed his PhD in cognitive psychology at the University of Newcastle, Australia, where he studied numerical cognition, models of decision-making, and human memory using experience sampling methods. During the COVID-19 pandemic, Dr. Garrett has engaged in the international efforts of establish public attitudes towards mobile tracking technologies and has been responsible for the rapid analysis and distribution of results in Australia. During this time, he has also used mobile tracking technologies to complete several experience sampling studies to seek and understand and improve the mental health of individuals in lockdown. Dr. Garrett will focus his discussion on how, acceptance of mobile technologies may or may not translate to technology uptakes, using the example provided by the Australian COVID-19 tracing app, COVID safe. So let's welcome Dr. Garrett.
Thank you, Cheng-Ta. Can you hear me well? Yep, excellent. And you can see my screen. Fantastic. Alrighty. So I'm just gonna swap screens around. There we go. So as Cheng-Ta introduced, I'm Paul. I'll be focusing on the acceptance and uptake of tracking technologies in Australia. And to do this, I'm going to focus my talk on the uptake of the Australian government's contact tracing app, COVID Safe. Unlike most other countries in our collaboration, Australia rapidly introduced a government-backed tracking technology. And this meant we're able to compare public acceptance with actual app usage on a national level. Australia is just now exiting its second wave of COVID-19 infections, and we managed to collect 4 nationally representative data sets early in the pandemic. The first 2 surveys focused on technology acceptance, and the second 2 focused on COVID safe usage. We collected COVID safe samples, one immediately after the app was launched, and one about 2 months later. During the course of the Australian outbreak, states have closed schools and businesses. They've introduced stay-at-home laws, enforced social distancing, and in Victoria, where Josh and I live, and where cases have been at their worst, mask wearing has become a mandatory policy. And amongst all this, COVID Safe has played something of an important role. So COVID Safe is the Australian government's contact tracing app. The app is voluntary, and it uses Bluetooth technology to create an anonymous registry of your nearby contacts. Data for the COVID Safe app is stored in a partially centralized fashion, and that means the data is stored locally on the user's phone, and in the event that they test positive with the virus, they can choose to upload their data to a centralized repository, which is only accessible by members of the health department. Now, these health department officials can then decide who among the registered contacts is likely to have contracted the virus, and they will directly contact them over the phone. This system is intended to ensure rapid manual contact tracing efforts while maximizing the user's privacy. So, we designed our study around the 2 surveys, the acceptance survey, which was used in the UK and Taiwan and elsewhere around the world, and a separate but similar COVID safe survey specific to Australia. We kept most elements consistent between the surveys for direct comparison, including the COVID risk and impact items and the tracking effectiveness questions like the benefits and risks. And we're fortunate that we can almost directly compare the government app scenario in the acceptance survey to the COVID safe app, because almost everything is the same in our descriptions of these 2 things. And we can look at how acceptance directly relates to app downloads. So this is very fortunate. Further to this, in the COVID safe survey, we queried through rank ordered questions why people downloaded the app or why they did not download the app, and a particular subgroup of people who said that they intend to download the app but hadn't done so yet, and maybe why this group were holding back. From a health perspective, that group is very important, as you want the most people to download these apps for them to be effective across the entire population. So let's have a look at some results. Now, our demographics for this survey, that's fine. We collected about 500 participants per scenario, and we removed people if they did not pass a comprehension check to make sure that the people were reporting on the actual technologies in question. We did have a slight bias as well towards a university sample across the board, but otherwise our sample was very representative of Australia as a whole. Okay. Here we have the acceptance data. On the left, you can see acceptance for the telecommunication network tracking. In the middle, this is the Bluetooth scenario, which describes the Apple and Google exposure notification system. And here we have the acceptance for the government app. And we'll compare these directly. So on the left, we have baseline acceptance. And what we see is that acceptance was moderate to high and ranges from about 65 to 70% for each technology. So they're quite comparable and they're quite high. With the inclusion of a sunset clause where data is destroyed after 6 months, we see that acceptance increases further, which is good. And in the telecommunication and the government app scenarios, if participants are able to opt out or store data locally on their phone, acceptance increases again. This is all simply to say that highlighting the privacy measures seems to be a key impact for getting people to accept these technologies. And so that's something that governments and policymakers should keep in mind. Now, how does this relate to actual usage? Well, on the right, we have the data for the COVID Safe app. From left to right, we see here the proportion of participants surveyed who downloaded the app, those who will download the app in the future, provided that legislation comes into place, which in Australia it now has. And on the right, those who have downloaded the app and also intend to download the app in the future. And that's that key group that we really need to make sure use the app. What's interesting here is that we can also compare acceptance directly to downloads. We see here that acceptance is about 65% among the population, but actual downloads are about 44%, which is markedly smaller than what you might expect. Let's be a little bit more generous though. COVID Safe uses a partially localized data storage option, so maybe we should compare it instead to the local storage option for the government app. And if you think about it, these acceptability judgments are more like an intention to do something rather than an actual behavior, so we could possibly compare it more generously to the intentions to use in the future. But even doing this, we still see a large intention behavior gap. From a health perspective, answering why this gap exists is critical. So, why the gap? Well, it could be that the perception of the virus. People perceive this virus to be less severe by the COVID Safe data samples, as cases had decreased in Australia. Or it could be that the media and the public perception of these technologies has shifted with more focus and more attention. And so we need to figure out which of these is driving this change so that health decision makers can be informed and sway public attitudes. So what we see here is the perceived risk from COVID-19 across our 4 data collection samples. Keep in mind that cases for COVID-19 decreased in Australia nearly down to 0 by this final collection. And what we see is that the perceived general harm, personal harm, concern for self, all decreased across the waves. However, concern for other people remained very high. This looks like a very important factor for driving people to actually use these tracking technologies. Here we have the perceived benefits from tracking, the ability to reduce the contraction, the spread, and return people to normal activities. What we see is that all these technologies were rated as a bit or moderately beneficial. Telecommunication tracking was perceived as the most beneficial in general, which is interesting. We did frame this as a mandatory technology, so that might play a big role. And COVID Safe was perceived as the least beneficial, quite less than the similar government app scenario. So this may be driven by the decreased COVID-19 cases in Australia. So we'll keep that in mind. On to the risks involved. This is interesting. Although COVID Safe was perceived as less beneficial, it's also perceived to be less risky. So we have here the perceived risk, which is quite reduced. It seems to have more data control than the other options, to show collect less sensitive data, and to have similar levels of trust and privacy to the other government app option. It shows more trust and more security than the Apple and Google exposure notification system, which indicates somewhat of a distrust of a corporate entity collecting their data. So, why the gap? This seems to suggest that it might be about how the virus is perceived that's driving this app uptake, and less about the technologies themselves. So that's one thing to keep in mind. But it's not necessary to just rely on this. We can instead ask participants directly, which is what we did. So we asked why people did or did not download COVID Safe. Among those who were using the app, most were early adopters. 86% downloaded the app in the first week after it launched. These people use the app very effectively. So 87% of those who had the app were registered. They had the app still on their phone, and they kept Bluetooth on when they were in public, which meant that the app could be effective. And more than half of these people had tried to share the app with their friends and family. Those are the people that you're most likely to be exposed to and spread the virus to. So that's a very important feature. Users were motivated to download the app, and we had them rank order a series of options, and these were the primary factors. So they were motivated to download the app due to government advertising and officials like politicians and the Prime Minister. They were motivated to safeguard public and personal health and to return to normal activities sooner. People who did not download COVID Safe did so due to concerns over privacy and government trust, battery usage, a fear of normalizing government tracking and government surveillance. And an important group here, that 1/3 did not download the app, and they required no convincing to reach that decision. Now just think this through. That means that they did not gain any other information about how the app worked or how effective it would be. They just decided outright they would never download the app. So that means that it's unlikely we could probably ever change these attitudes in this 1/3 of never users, essentially. And I think that may play a role in or misinformation may play a role in that entrenched attitude. So here we have the perception of what the technology that runs COVID Safe is. So we asked them, the app actually uses Bluetooth technology to make its registry. We asked them, does it use Bluetooth, GPS location data, telecommunication data, or do you not know? Those who do use the app, the yes group, overwhelmingly said Bluetooth. However, those who do not use the app were nearly comparable for saying Bluetooth, location data, or they did not know. And that speaks to a misinformation about how the app operates, and something that government advertising needs to target and essentially fix in order to get uptake to increase among these non-users. We also looked at those people who intend to download the app but haven't yet downloaded. And what we see is that the main reasons they haven't downloaded COVID Safe is that they're still weighing the pros and cons. They're still conducting this privacy calculus that Josh talked about, deciding if it's worth their time, worth their personal data to help the wider public. When the app was newly released, the other top responses were technology issues, which COVID Safe had several, and that they were not leaving the house. We were under lockdown during that time. When 2 months later passed, These responses changed to that people were waiting on others for it to be effective, and they had not considered it yet. So advertising was not hitting these people. They were not being exposed to downloading the app anymore. So via the gap, it does look like it's not just how the virus is perceived, but definitely how the technologies are perceived and how these technologies are marketed. So in summary, public acceptance for tracking technologies from cases where declining did not translate to app uptake. The results suggest uptake is dependent on the perceived severity of the pandemic and the privacy measures that accompany them. Therefore, policymakers may view our results as a benchmark of attitudes and behaviours, with acceptance and uptake only increasing as cases increase in Australia. To improve these apps' effectiveness, not just for COVID safe, but for any app introduced around the world, I think policymakers need to target those who are accepting of the technology, but are yet to download the app. This could be achieved by improving the messaging around the privacy measures that accompany the app, marketing the app's usability and shareability, and building the technology type into their advertising. Policy messaging was most effective when presented by government officials, government advertising, and targeting people's health, others' health, and returning to normal activities. And possibly making an app mandatory, like the telecommunications scenario, may be necessary if non-using behavior is entrenched in the population. And that will do. Thank you very much for our time. It was absolutely lovely to be here.
Thanks, Paul. So let's thank Paul again. So I would like to thank all the speakers again. And I think we just run out of time, so we will just close the symposium here. If you have any questions, we can discuss more during the break. Thank you, everyone.
感谢各位讲者的精彩演讲，也感谢杨正达教授为我们主持这场演讲。